Okay, so what I'm doing here, this is a patient with a fairly moderate size intrarenal kidney stone. So I'm now uploading the wire through the DURS. I'm lining up the DURS with the patient's ureter, trying to keep it in kind of an anatomic alignment so it slides up more easily over the wire to prevent some of the buckling at the UO. The scope went up fairly smoothly over the wire, and I have my assistant hold a little bit of back tension on the wire. Now I'm connecting the scope to irrigation, and then we'll start to explore the kidney. All right, so I've got my flow going. I've got my scope more or less in line with the ureter, and I'm ready to explore the kidney. As you can see, my hands are kind of in a normal ergonomic position. I'm not having to rotate my wrist too aggressively. I'm now feeding the laser fiber up through the scope. You can see the laser fiber coming out of the tip of the scope. And then what I'll start to do is work the edges of this intrarenal stone, trying to dust the stone into very small stone fragments. I'm not a basketer, so I usually use a dusting strategy. And you'll see me here with the laser just basically painting the edge of the stone. Occasionally, you will see some interference or some scrambling of the screen. I find that to minimize that, I try to keep the tip of the scope further away from the stone. Sometimes if I'm too close to the discharging laser fiber, that can increase the scrambling, especially if you're working in a smaller calyx or a tighter space. I'm basically just working around the edges of the stone here with the laser, dusting the stone. As I'm lasering, I'm noticing the stone has a very hard composition, so it's most likely calcium oxalate dihydrate. So I'm just adjusting the settings of my laser to accommodate for that. So I'm going to use a little bit higher joules, which should increase the fragmentation rate and speed up the case a bit. Also, sometimes you'll notice with these larger stones, after you start to get some of the stone fragmented around the edges, you start to make more progress because you've destabilized the structure of the stone, so it's easier to fragment the stone in the laser procedure. So it's a pretty large stone. This is a 1.3 centimeter stone, so we're having to use the laser at a fairly high energy level relative to my normal settings. I'm just continuing to work the edge of the stone, trying to keep the fragments very small and dust-like. You can see in the left here, my hands are still in a normal ergonomic position. I'm not having to crane my shoulder or elbow too much. My wrist is in a straight location, and I'm using my thumb and forefinger for flexion and extension. So it's really not putting a lot of stress on my body to kind of contort myself the way sometimes you have to do with flexible ureteroscopy to move the scope tip around. I also am only using one hand here. I'm not having to use two hands because with the metal body of the scope, the movement at your working hand translates directly to the tip of the scope. So I'm not requiring a second hand to manipulate the scope at the urethral meatus, which is very helpful and allows it less wear on my hands during the procedure. It's just continuing to work around the edges of the stone here, fragmenting it into dust-like particles. And now this is just kind of skipped ahead to after the stone fragmentation has mostly been completed. And I'm just exploring different calyces. And then as I find any larger pieces, I'm continuing to work on them. If I have a larger piece break off during the dusting procedure, I try to follow that piece and chase it so I can fully fragment that extensively, as opposed to letting larger pieces accumulate, which can be harder sometimes to dust at the end of the procedure. You can see how hard this stone is. There's like a black center. Once you get the initial surface layer off, that black center is almost certainly calcium oxide dihydrate, which is one of the harder stone compositions. So it's just taking a lot longer with the laser to fragment this stone due to the hardness.
Richard Wolf, Spirit of Excellence.